So then, Peter, you kind of hinted at it there, but a lot of people who are in the older category, they may be concerned about resistance training due to potential injury. So when you have your patients who are older start to resistance train, start to build muscle, are you worried about injuries? Kind of how do you speak to them about how they should think about that aspect, especially starting out or if they've never started before?
Truthfully, I think anybody who's worked with people, be it athletes or people who are really deconditioned, you always have to think about this, right? Because you're always balancing providing enough training stimulus to get the benefit. And remember, training is a hormetic activity, right? It has to create a stimulus, whether that be on the aerobic system, whether that be for the type 1 fiber, the type 2 fiber, like there has to be a stimulus that comes from pushing outside of a comfort zone. So we have to have that training stimulus, but we know that if we do too much, we're going to get injured. And I hope that by now I've made the case for why injury must be avoided at all cost, because injury means time to decondition. And the older we get, the more problematic that gets. Again, I think about the back injury I sustained when I was 27 years old that basically left me unable to walk for 3 months and unable to do much of anything for 9 months. Well, today, if you look at me, there's really no lasting effect of that. But imagine that had happened to me when I was 70. That's it. My life is over. Like, I never get back to where I was. So it's probably safe to say that the most common reason for injury when you're starting out is progressing along the intensity axis too soon. So remember, we talked about how you push frequency, you can push duration, you could push intensity. I think you want to err on the side of, again, my heuristic is move the frequency, then the duration, lastly, the intensity. So that's clearly true on the cardio training side, but I think it's also true on the strength training side. Obviously, another very important part of injury is just a lack of neuromuscular control. So that accounts for many things, from why people fall more frequently as they age to how people get injured when they can't. If we're just limiting it to talking about strength training, why are individuals getting hurt when they're lifting weights? Well, a lot of it is maybe they're moving a weight that they can't control. We've talked a lot about the importance of being able to control the eccentric phase of a movement. And I think we've all seen someone in the gym who's just throwing weights around and getting away with it, but that you're going to stop getting away with that the older you get. So we want to really make sure that people have the coordination. They're doing the types of drills like agility ladders, hand-eye coordination exercises, ball tosses, such that they're kind of generating neuromuscular control in addition to strength. Probably the other big area where we see injuries is due to a lack of movement variability. People say, well, do I need to squat and deadlift and bench press? And I think the short answer is no. I think a lot of those things can be done with, for example, squats and deadlifts. You can accomplish many of those goals using single leg variants that are far less weight. And even something like a bench press with a bar, I would much rather substitute in, once you're ready for that, floor presses and single arm floor presses. So you'll have one arm, you'll be laying on the floor with knees up, feet flat on the ground, one arm straight up, the other arm doing the presses. And again, what's nice about that is on a floor press, yet your range of motion is nowhere near what it is on a bench, because you're obviously not going to be able to bring the elbow, below your back, which you could on a bench. So you lose a bit of range. It's clearly not as good a, quote unquote, as good a pec exercise, but there's also a very good margin of safety there, right? Think about how much harder it is to hurt yourself doing a floor press than a regular traditional bench press. So, these are just some slight examples of ways that you can think about minimizing injury. And that's by the way, just as an example, like when I was coming back from shoulder surgery, I mean, it was probably a year of just doing floor presses before I proceeded to go back onto a bench.